As per the Kenya Demographic Health Survey that was released last year, stunting levels of Busia County stands at 15%, underweight is at 6.3%, and you find that wasting is at 2.8%. Therefore, you find that we still have a long way to go when it comes to nurturing care, whereby our children are still malnourished, and therefore the most important thing that we need to do is to ensure that the information on nurturing care, nutrition reaches our people, reaches the community, so that people can start improving on the diets they feed their children. As per the SMART survey that was done, you'll find that only 32% of our children eat at least foods from 4 groups and above, but 68% eat less than the recommended 4 groups.
And one of the biggest challenges that we have in Busia is neglect, as it is clearly seen from the Child Protection Information Management System. Neglect takes up 58% of the cases that are reported to our office. And when you are looking at nurturing care, we are seeing that most of those children are neglected between the age of 0 to 5. And 0 to 5, we realize that those parents who are neglecting these children are the same parents who are very young parents between the age of 15 and 25 years. And it's a great concern because these parents start being parents at early stage when they do not know what are the basic needs and how to provide these basic needs. Because when you look at nurturing care, we are thinking about having better nutrition and what we call adequate diet. We are looking at access to medical care. We are looking at early access to education, and we are looking at how parents are taking care and protecting their children from abuse, looking at the safety and security of children.
The decision to come to Busia was informed by many factors. The objectives that we are pursuing as a project, there are 3. One is focusing on improving the skills, especially the parenting skills of these caregivers, because that was an area of gap when we were asking the question of what are these priority areas in promoting child development. That came out strongly from even duty bearers, that one of the biggest gap is caregiving skills. So it forms our first objective. The second objective that we're also pursuing as a project is on improving the caregiver well-being. We realize that in the components of nurturing care, there are 5 of them, but the biggest one of all is responsive caregiving, which stands squarely on our parenting skills and how best we take care of these children. One of the things that we are struggling with today is the mental status of the caregivers. The social environment is so stressing, and you find children being victimized by regression